Hi, my name is James Crumpton and I'm the clinic director here at the Joint Regeneration Clinic of Fleming Island. We're so glad that you're here. We understand that you've been experiencing some pain or discomfort in one, if not both of your knees, which may include symptoms like popping, clicking, reduced mobility, and joint stiffness. And if that's you, then you're in the right place. We're so excited to share with you our breakthrough treatment plan delivered by state-of-the-art technology. And after that, we'd just like to take a moment to answer any questions that you may have. But first, let's take a look at the anatomy of the knee. Within this knee model, we can clearly see a representation of the femur, the patella or the kneecap, as well as the tibia and the fibula. But more importantly, I want you to look at the blue, which represents the cartilage within the joint space. The cartilage is there to provide cushion and support to the bones within the joint. And what we can't see or appreciate in this model is the invisible capsule that holds the synovial fluid. Synovial fluid is your body's natural lubrication that cushions the cartilage and allows the cartilage to be soft. As a result of osteoarthritis, over time, there is less synovial fluid, and that directly contributes to the cartilage becoming more rigid, less flexible, hard, even absent. All of those work together to contribute to worsening symptoms of pain. The good news is we can help treat those symptoms. Our treatment plan consists of 3 scheduled visits over a 4-week period. So what is PRP? PRP is autologous, which just means it comes from your own body. We take your blood and we put it in a state-of-the-art centrifuge and we separate your plasma, platelets, and exosomes from the rest of your blood. We also add an extra component to the PRP process known as exosomes, which we like to refer to as our body's own little super healers. Exosomes improve communication between the cells. Next, we extract the concentrated platelets and exosomes. Then, under fluoroscopy, we inject them into your knee joint. Fluoroscopy is just a live X-ray that takes out the guesswork. It allows me to safely and effectively administer the PRP and exosomes into your knee joint. PRP goes to work immediately on the inflammation in the joint. It activates growth factors that signal the healing and joint regeneration process to begin. Finally, we'll send you home with a custom-fitted knee brace that keeps the joint space open, that allows the PRP and exosomes to move freely within the joint space. At each visit, we'll make slight adjustments to your knee brace to ensure that it stays aligned properly as your knee mobility begins to improve. So, the combination of PRP, exosomes, along with our offloading knee brace provides the most optimal outcome for the success of your treatment.
Thank you for taking the time today to answer my questions. I really appreciate it. What are the risks involved with the procedure?
That's a great question. There are a couple risks associated with our procedure. The first being infection. We do a good job of ensuring that we don't have infection because we clean the area very aseptically, which just means we're applying some povidone iodine and then cleaning that area with 70% isopropyl alcohol and then numbing it with some ethyl chloride. So that helps reduce the chance of you really having an infection. The other would be bleeding. We have minimal to no chance of that because we do a good job of applying a pressure bandage after each procedural injection. As a result, you have little to no chance of bleeding.
Can I drive myself to and from the appointments, or do I need a driver to come with me?
We have a lot of patients ask that question because typically after procedure, patients think they're heavily medicated or they're in pain or whatever. Our patients drive themselves to and from the procedure without any trouble at all.
How does the procedure compare to steroid shots?
That's a pretty common question that we hear. Steroids are very important and they have their place in medicine. Like for example, if you're in the hospital and you have a lung infection and there's a lot of inflammation, that's a good time to have steroids. But in an outpatient scheduled procedural appointment like this, you don't need that because steroids long-term can have reduced effectiveness. They can worsen the cartilage and harden the area, increase inflammation. Bad side effects associated with them are weight gain, mood changes, and a decreased immune system. And unfortunately for our diabetics, they have hard blood sugar spikes, which is not good for them in the long term. None of that exists with our PRP.
Are the shots going to be painful?
Are the shots painful? Who's not scared of an injection? Our patients describe it's more or less a discomfort or a pressure, not so much pain. It's minimally invasive, and the actual injection is probably 3 minutes or less.
I'm really looking forward to getting started back with my life because I love to ride my bike, I love to walk, I like to go hiking, so this is going to be a really nice lifestyle change for me. I didn't think I'd ever have it again. My final question, will my insurance cover this?
Unfortunately, insurance does not cover PRP joint injections. However, our clinic does accept all major credit cards, cash, HSA, FSA, and Care Credit. If you choose to use the Care Credit option, our clinic offers a 6-month interest-free promotional plan.
So when can I book my first appointment? I'm really excited to get started.
Super easy. We have a great front desk staff. They're very receptive. You just coordinate with them the day of, we can get you scheduled. We really appreciate you coming in today and watching our video. We'll be in shortly with you to answer any additional questions you may have.